The FDA has released new standards officials say could help women detect breast cancer earlier.
Mammogram providers will now be required to inform women if they have dense breast tissue. The American Cancer Society estimates nearly 300,000 women will be diagnosed with invasive breast cancer this year. It also predicts more than 43,000 of them will die from the disease.
Joining us now is Dr. Jessica Shepard. She is a chief medical officer for Verywell Health in Dallas. Dr. Shepard, thanks for joining us. Can you, just to start, explain these new requirements?
Now, you expressed there in the statistics that you were talking about invasive breast cancer. And we do know that breast cancer is the most common cancer and leading cause of cancer-related deaths among women. So it really is essential for us to have early diagnosis. And when we do have early diagnosis, we can really reduce that breast cancer-related burden and mortalities. Now, when we're talking about the FDA and releasing these new guidelines, it really is looking at the density of breasts and what that really means, because breasts do have dense tissue or fatty tissue. And we do know with dense breasts, you are more likely to see, one, the decreased ability through imaging to detect some breast cancers. But also, when we looked at a study and was looking over 9 observational studies, the conclusion was looking at women who do have more dense breasts actually do have an increased risk of having cancer that is not necessarily detected.
Yeah, I mean, you basically, I think, answered this next question. Roughly half of women 40 or older have dense breasts. So how much more at risk of breast cancer are they?
They actually are more at risk. And when we were looking at the study, significantly resulted in a 2.1-fold, which is looking at an increase of breast cancer risk compared to those who have scattered dense breast tissue. So again, we're looking at extremely dense breast tissue versus scattering of the dense breast tissue. But really, we're not really educating women on what the differences are with dense breasts and how common they are. And you just said that nearly half of all women who are 40 and older and get mammograms are found to have dense breasts.
Dr. Shepard, the only way for a woman to really know if she has dense breasts is by having a mammogram. Does an initial finding of breast density automatically mean more tests for women?
And I'm glad you mentioned it that way, because again, this is really a guideline to not scare women who do have dense breasts, but really having the understanding in the mammogram findings and knowing that they may have more testing that is needed in order to really stratify what the breast density means, but also how does that relate to them in detecting breast cancer, especially early. And that really does help with what type of testing they're getting, whether it's a 2D mammogram or a 3D mammogram. But these are important points that should be brought up with a provider and their patient about the outcomes of their mammogram.
Dr. Shepard, I actually was one of these women, and my doctor recommended after a mammogram, because it's harder to detect cancer if you do have a higher breast density, to have an ultrasound or sonogram, which is typically not covered by insurance. Is that the case? It seems to be happening more and more for women?
Yeah, we do find that the more density that you have on your breasts and further testing might have an ultrasound that's needed. And some carriers are not necessarily covering that testing, specifically if a woman doesn't have necessarily a high familial history of breast cancer or high risk factors in general. So I think with the FDA passing this type of statement and these type of recommendations, we are going to start to see changes in how that coverage is with insurance and how many more payers are going to actually give this as something that is absolutely necessary when we look at dense breast tissue, mammogram screening, and what that means for cancer diagnosis outcomes.
Yeah, I mean, with this kind of finding sort of officially proclaimed in this way, you would hope that you might see some changes in that. Dr. Jessica Shepard, Dr. Shepard, thank you so much for sharing your expertise with us.
Thank you.